Good morning, everybody. Thank you all for being here as we gather to recognize Parkinson's Awareness Month. Today's proclamation brings attention to a condition that affects many individuals and families in the community. By raising awareness, we help encourage early diagnosis, better care, and greater support for those impacted. Before we begin, I'd like to acknowledge and thank the following individuals for being here with us today. Starting off with the Mayor of the City of Laredo, the Honorable Dr. Victor Trevino, and his wife, Ms. Rosa Marquez de Trevino. Health Department Assistant Director, Ms. Erica Martinez. Dr. Julie Bassan, Executive Director for the Area Health and Education Center. Ms. Libby Caso, representing Mercy Clinic of Laredo. Ms. Oda Garcia, representing DSHS Region 11. And Ms. Jimena Morales, representing Consul. To start our program, I'd like to invite the Mayor, Dr. Victor Trevino, to share a few words.
Thank you and good morning. Back to be here again, which is my second home, looks like it. Anyway, happy to be here to bring awareness to Parkinson's Awareness Month. Perfect time to brush up on our Parkinson's awareness. Even if a doctor, it's not easy to diagnose Parkinson's. There's currently no single or definitive test that can diagnose the condition because other conditions have similar symptoms. And the key is to be aware and make people aware and families that have had Parkinson's and the age they started to develop symptoms, which could be a key to diagnose it. For most people, these symptoms start around the age of 50 years old. Some symptoms include tremors, rhythmic shaking, usually starting at the hands or feet, rigidity, stiffness in the muscles, make it difficult to move, bradykinesia, slowness of movements and making everyday tasks difficult, postural instability, difficulty in maintaining balance and coordination, gait changes, shuffling or stoop posture while walking. The key to diagnose the condition is staying healthy and early detection, because about 90,000 people in the U.S. are diagnosed with Parkinson's disease each year. Scientists believe that a combination of environmental and genetic factors are involved. People with Parkinson's experience both movements and non-movement related symptoms. Now, the good news is that symptoms can be managed with treatments like medications, Sinemet, and other anti-Parkinson's medication, lifestyle changes, exercise, and in some cases, even surgery. So as a community, we need to come together and empower ourselves to become informed and mitigate Parkinson's in our community. And we'll stand by for the proclamation. Thank you. I just leave it here.
Thank you, Mayor. And before we move on, I'd like to recognize one more person, Mr. Andres Velasquez, here representing Congressman Henry Cuellar. And next, please welcome Ms. Erica Martinez, Assistant Director of the Laredo Public Health Department.
Thank you, Jaime, and thank you everyone for being here today as we recognize April as Parkinson's Awareness Month, a time to raise awareness, show support, and stand in solidarity with individuals and families affected by Parkinson's disease. As Mayor mentioned, Parkinson's is a progressive neurological condition that impacts movement, balance, and quality of life. It affects nearly 1 million people in the United States, with thousands more diagnosed each year. While there is currently no cure, there is hope through continued research, advocacy, and compassionate care. As the public health community, it is our responsibility to promote awareness, encourage early diagnosis, and support those living with this disease. Together, we can help foster understanding, reduce stigma, and contribute to a better future for those impacted. Today, we reaffirm our commitment to public health education, and support services that bring dignity and strength to our community. Let this proclamation serve as a reminder that we are united in this cause. Thank you.
Now I invite Ms. Oda Garcia. Ms. Garcia serves with the Texas Department of Health and Human Services and plays a vital role in supporting health initiatives throughout Region 11. Help me welcome.
Thank you, Mr. Perez. Good morning, everyone here today. On behalf of the South Texas Department of State Health Services Region 11 Medical Director, Dr. Emily Prott, and the Office of Border Public Health Program Manager, Ms. Alma Ochoa del Toro, I want to thank you all for being here as we recognize Parkinson's Awareness Month, a time to honor the strengths of those living with the Parkinson's disease, support their families, and raise awareness as a community. This moment is made even more meaningful thanks to the support of our wonderful partners. The Laredo Public Health Director, Dr. Richard Chamberlain, Ms. Erica Martinez, Assistant Director, and their wonderful staff, Dr. Montes, Mr. Perez, and Ms. Jimenez, who have supported this cause and bringing this proclamation together. The City of Laredo Mayor, Dr. Victor Trevino and his beautiful wife, and our wonderful partners, the Area Health Education Center, Dr. Julie Bazan, Mercy Ministries, Casa Misericordia, VEO, all the departments from the Laredo Public Health, and our Congressman, Henry Cuellar. Thank you all for being here today. And thank you for your commitment to the health of our community. Your leadership and partnership makes events like this possible, and your support sends a wonderful message to everyone affected by Parkinson's disease. You are seen, you are valued, and you are not alone. Thank you.
Now, Mayor, we proceed with the proclamation.
Thank you.
Do you guys want to stand with him while he reads the proclamation?
Yeah. Office of the Mayor, City of Laredo, Texas Proclamation. Parkinson's Awareness Month. Whereas Parkinson's disease is a chronic progressive neurological disease and the second most neurodegenerative disease in the United States. Whereas Parkinson's disease is estimated to affect approximately 1 million people in the United States, and the prevalence will rise to 1.2 million by 2030. Whereas 90,000 new people are diagnosed each year in the United States with Parkinson's disease. Whereas Parkinson's disease is the 14th leading cause of death in the United States, according to the Centers for Disease Control and Prevention. Whereas it is estimated that the economic burden of Parkinson's disease is at least $52 billion annually, including direct and indirect costs, including treatment, Social Security payments, and lost income to patients and their family members. Whereas research suggests the cause of Parkinson's disease is a combination of genetic and environmental factors, but the exact cause and the progression of the disease is still unknown. Whereas there is no objective test or biomarker for Parkinson's disease, and there is no cure or drug to slow down or halt the progression of the disease. Whereas the symptoms of Parkinson's disease vary from person to person and can include tremors, slowness of movements, rigidity, difficulty with balance, swallowing, chewing, and speaking, cognitive impairment and dementia, mood disorders, and a variety of non-motor symptoms. Whereas volunteers, researchers, caregivers, and medical professionals are working to improve the quality of life for persons living with Parkinson's disease and their families. Whereas increased research, education, and community support services, such as those provided by the Parkinson Foundation and the other organizations are needed to find more effective treatments to provide access to quality of care to those living with the disease today. Whereas, the Laredo Public Health Department and the Texas Department of State Health Services will continue to promote education and awareness on Parkinson's disease year-round in an effort to support those affected and encourage early detection and intervention. Now, therefore, I, Dr. Victor D. Trevino, Mayor of the City of Laredo, do hereby proclaim the month of April in the year 2025 as Parkinson's Awareness Month. Thank you. We'll take a picture.